Hi, this is Searcher in Charge. We're here to help you find quality answers to your questions. This is video 5 in our series of videos that help you find quality health information. In this video, we will continue learning how to analyze the information we find and be our own searcher in charge of finding quality answers to important health questions. Our goal is to learn how to find quality health information and discuss it with our healthcare professional if important. Today, we are going to look at 2 web pages and analyze the quality of the content so we can learn to do this on our own. If you want to practice along, pause the video in a few seconds, open up your web browser and the 2 web pages in a separate tab for each website. I will show you how to open up more than one tab in a few seconds. You can pause any of the Searcher in Charge videos by clicking anywhere on the video, then click again to restart whenever you want to practice something. Here is a search showing you how to open up 2 tabs using Internet Explorer. Here is one way to open a few tabs so you can compare information side by side. Up in the address bar, I'm going to type in Mayo Clinic and I start to see some suggestions. This is the correct one, so I'm going to click on it, and I can see on this tab it's opening mayoclinic.com. Previously, I had typed in the hospital's URL, and I have them on this tab as well. How I can get a couple of tabs is I can look to the right, and here I see it says Open a New Tab. I can also get a new tab by doing File, New Tab, and a new tab will open on that as well. Okay, here is an easy way to remember what to look for on a web page. CRAP. It stands for Credible, Recent, Reliable, Authority, and Purpose. We will apply the CRAP test to one quality source and one that is not a quality source so you can see what to look for. Starting with C for Credible, let's read the address for the web page as we learned in video number 4 to make sure we know whose home we are in and see how professional they look and if there is an About and a Contact link. The About section should tell us who they are and what they do. It is like when you meet someone, you want to know who they are, what they do, and have a favorable impression of what you see and read. Remember, you can pause the video anytime and look at the websites in your browser. We see they both have an About link, can be contacted via email, and look pretty credible at this point in our analysis. Even though the web pages both look good, guard against assuming that web pages with lots of logos, statistics, links to other materials, or generally look good as automatic reasons to trust a website. All these can be deceiving and looks can be deceiving, so let's press on with our analysis. Your web page will look different than what you see here as I've taken pictures of parts of a web page so we can see it clearer. Just look for something like you see here in your browser and you will do fine. Now, because we know looks can be deceiving, another tool to determine website credibility is domaintools.com. They provide domain name ownership records. The domain name is like a name and an address for the website. In the Who Is Lookup search box, I typed in the name of 2 websites and used 2 separate tabs so I could have the information on 2 tabs. This allows me to click on one tab, then on another tab to see different information. In this video, I copied sections from the different tabs and put it here so it's easier for you to read. Like you, when I am on the web searching, I am clicking on each different tab to read different information. Remember, you can pause, practice what you see, then restart the video, and that I'm showing you only parts of the web pages, so what you see will look a bit different. Now, here we see information from the Who Is record for each hospital. The first thing that stands out is that the email search appears to be associated with the Mayo Clinic, yet not for the hospital. Moving down the page, we see the Mayo Foundation has a street address, the hospital a P.O. box. All of Mayo Foundation information is in the same city, while the technical contact for the hospital, a supposedly large hospital in New York, is in Fort Lauderdale. All this does not seem quite right. By calling the number listed for the administrative contact, I found it was disconnected. This is enough information to find this website suspicious and not credible. The Site Profile tab on DomainTools.com will also give you more information on a website to help determine if it is credible. You would not do this with every website, yet now you know when it is important you have this tool. Later, you can practice the CRAP test with the websites mentioned on this video, so let's finish out the CRAP review and learn what to look for. The first R stands for recent. The Mayo Clinic has very recent information, and this is not found on the hospital site. Reliability means the information is verifiable by other sources, accurate and reasonable with today's knowledge. The hospital lists head transplantation surgery as one of their services. After some research, I found currently this is not a reasonable procedure for humans. Talk with your healthcare professionals and ask a librarian for help in finding quality sources to verify what you are reading. You must have more than a couple of sources that agree with important health questions. A is for authority, and the hospital lists many doctors with what appear to be impressive credentials. See what publications are available by these doctors. If we try to find publications written by Dr. Elizabeth Pretner, who was listed as the administrative contact in DomainTools.com, we don't find any scholarly work. One way to do an initial check on what might be written is to put the names of the doctor in Google Scholar. When I put in Dr. Elizabeth Pretner from the hospital, I received one result, which is too few for any legitimate doctor. On the MedlinePlus.gov About page, they list Dr. Donald A.B. Lindbergh, and there are over 10,000 results for this name in Google Scholar. For important health questions, you would continue to verify your information with other sources. You now know that the RYT hospital does not list at least one doctor with any authority. How many more doctors are like this on their website? Lastly, the P stands for purpose. The hospital's purpose looks good, yet because they fail all parts of the CRAP test, they are not a reasonable website. Purpose also needs to be analyzed when viewing information from any company selling a specific product or service. Their purpose is to sell their products or services, and this may or may not be the unbiased information you need. Because this is important, I will say it once again. You will need to verify your information with several sources for important health questions. You can use the CRAP test with all of your sources of information to help you find quality information. If it does not pass the CRAP test, move on. There are plenty of good ones out there. If stuck, contact your healthcare professional and/or librarian. Here is a list of sources on analyzing websites if you want to see more examples and practice analyzing other websites. Okay, here's what we learned today. Use the CRAP test to avoid non-quality sources. You will need several sources of quality information with important health questions. Talk with your healthcare provider and/or librarian to help find quality sources of information. You can pause, practice, and replay any of the Searcher in Charge videos by clicking on the videos to start and stop. What we each see on the web page will look a bit different than what is shown on the video. Look for similar images and text on your screen. This is Lark Birdsong of the Information Literacy Initiative at the University of Washington Information School, bringing you Searcher in Charge to help you learn how to find quality answers. See you on our next video.